Hi, my name's Jessica Thompson and I'm from the End of Life Care team. And this short presentation is about the patient and carer assessment audit that my team completed in 2018 and a little bit about the record of care document, which was also new last year. Who provides palliative care and end of life care on the Wirral? The answer to that is we all do. What were the aims and objectives of our audit? The aim was to ensure compliance with trust and NICE guidance for the management of end-of-life care patients. And our objectives were to assess compliance with end-of-life care standards in the community setting and to identify the components of best practice underpinning high-quality end-of-life care. Our target group was end-of-life care patients diagnosed as being in the final year of life and who had a palliative and carer assessment care plan in place. We excluded any rapid deterioration and any sudden death. We looked at 50 patients' records from right across the Wirral, 5 per community nursing team. And this data was collected throughout August 2018. So of those patients who had a PACA in place, we wanted to have a look. Was their symptom score recorded on the initial assessment? Was the insight score recorded on the initial assessment? Was their pain assessed and recorded at each visit on the PACA? Was it recorded if they had a DNA CPR form in place? Had they had a MUST risk assessment tool completed? Had they been offered the PPC document or the rationale documented as to why not, and was their PPC documented at all? Were the 4 main domains of palliative care assessed and documented? Was there evidence of shared decision making, and that could be anywhere throughout the patient's notes, so that was in the tabbed journal? Was the patient coded appropriate to current condition and prognosis? So that's the colours, the green, amber and red colours that we use as part of the North West End of Life Care model. Was an informal carer offered an assessment, and if it was declined, was it recorded? And was there evidence of use of the palliative care handover form? Following the audit results, we aim to improve as a priority the below areas. Coding of patients appropriate to current condition and prognosis, so again, using the green, amber, red colours. Documentation of DNAR form, the usage of the palliative care handover form, documentation of the patient's preferred place of care, documentation of a carer assessment, and evidence of shared decision making. And we strongly believe that all these things are done, they're just not documented in the correct place. So what is the End of Life Care Register? The End of Life Care Strategy from 2008 defines end of life as the final 12 months, the final year of somebody's life. And anybody in the Wirral who is thought to be in their final 12 months of life is listed on the End of Life Care Register. And it doesn't matter where they're from, that's people in their own home, care home, supported living, hospital, hospice, etc. And that means that their information is shared then between lots of different services. The GP, and they'll discuss their patients at GSF meetings where they discuss the green, amber and red colours. GP out of hours, and all community services that access System 1. The End of Life Care Register tells us this information about the people that are on it. It tells us whether they're green, amber or red, so that's those colours there, and that's the North West End of Life Care model. Where their preferred place of care is, are they for resource, and have they got an emergency healthcare plan in place? And again, that information is then shared and seen by lots of different people and professionals. There are 3 different end-of-life care plans on System 1, and they come under number 12 on Add Care Plans. There's the Last Days of Life Care Plan, which we'll look at later on. There's the PACA, the Patient and Carer Assessment, and there's the Syringe Driver. So we were initially looking at all patients who had a PACA care plan in place. When you first log into a patient's record, a sign will come up reminding you to complete the PACA handover form. You can press OK and you can fill in the form there. Or whilst you're completing the PACA, there is a box which brings up the template there, the Community Nursing Palliative Handover form. It pulls through automatically most of the information, and then you can add in the bits that you want to add in. Here's what the end-of-life care handover form looks like. It has changed recently to make it more user-friendly and to make it shorter. So most of the information will pull through. You can add in there whether you think they're green, amber or red. It's also reminding again about the record of care, which we'll look at in a little bit. Are they for resource? Is there an emergency healthcare plan in place? Where's their preferred place of care? A death notification box for when they've died, and your details there when you filled it in. And this should be completed any time there's any changes with the patient. When you log into System 1 and look in the top right hand corner, it will tell you whether the patient is green, amber or red there, and where their preferred place of care is. So you can see for this test patient, that person is green and their PPC is home. And that information is there because somebody's filled out a palliative care handover form for that person. There will also be an alert in the top if the patient has an emergency healthcare plan in place. It will also tell you whether that's available in record and attachments, or if not, where you can find it. So it might be that you need to speak to the GP or the care home about it. So now we're going to look at the Wirral Multidisciplinary Record and Prompt for Adult Care in the Last Days of Life, and it's known more simply as the Record of Care. It's available on the intranet staff zone to print out. Nursing homes have copies, and GPs should have copies as well too. GPs have had training on this, and so have care homes. This document is for use when somebody's in red, the last days of life, in the dying phase. This document underpins the 5 priorities of care for the dying person. And this comes from the One Chance to Get It Right document. And this document came about after the LCP was removed. It's also underpinned by NICE guidance, care of dying adults in the last days of life. And this is what the document looks like. And this is the main leaflet that should go alongside it too. It says in the bottom there that 2 leaflets should be given once a person is started on this document. The back page of the document is a leaflet, and the other leaflet is this. It's a brilliant leaflet. It's best practice for this document to be used everywhere on the Wirral now, no matter where that person is, and it can transfer between settings, including care homes. The aim of the document is to provide a framework in line with national guidance, so that's the One Chance to Get It Right document and NICE guidance. And the aim is to standardise and improve care of the dying person in the community, no matter where they are. To provide prompts and reminders to deliver holistic and individualised care. And to improve communication between healthcare professionals, patients and relatives. As on the Wirral, we often struggle as our services have different systems such as System 1, Cerner, Liquid Logic, whereas the idea behind this is a paper document that everybody can use and everybody can see. And hopefully that should help avoid duplication of difficult conversations and provide clear documentation which is transferable between settings so it goes with them wherever they go. So how it works, it's a paper document for now and it stays with the patient at all times. It shouldn't be locked away in any cupboards or any notes. It should be out in the open for everybody to see. And that includes the patient and their family too. At the point it's decided that the person has reached the dying phase, remember to fill in that handover form to make sure the person is now read on the end of life care register. The document should be discussed with the patient and family, and if they disagree, then go back to usual documentation. The initial assessment is the 5 priorities of care. The questions are based around those 5 main things. The initial assessment can be completed by a GP or a registered nurse, and that includes care home nurses as well too. However, if it's completed by a nurse, it must be signed by a GP within 24 hours. If you've started it as a nurse and you've asked the GP to come within 24 hours and they haven't come, just make sure it's clearly documented but carry on using the document. Once the record of care is in place, you no longer need to fill out the PACA. Instead, there is a much shorter, simpler care plan called the Last Days of Life care plan, and this can be added. Then everything is handwritten into the record of care documents, and these few questions are filled out on System 1. And you can see there is also a template for the palliative handover form, so if you still need to change them to red, you can do it there and send it from there. The ongoing regular assessments can be filled in by anybody caring for the patient, auxiliary staff, nurses, care home nurses. Anybody that notices any of those things listed in the boxes can write onto here. And that helps form part of the daily clinical review. There should be a daily clinical review, and that's shared responsibility between a GP and a registered nurse. And that's just looking at things like, is it still appropriate? Is this person still in the dying phase? How are they managing? How's their symptoms? And how's their nutrition and hydration? And you'll notice nutrition and hydration is documented a lot throughout this document, and that's after obviously the main concerns of the LCP. Anybody else can write on the continuation sheet. Again, any significant conversations, any other information you want to record, and anybody can write into that too. After death care is exactly the same. Community nurses to take a record back and scan them to System 1, and the GP will scan it onto their system, which is EMIS. We then need to send a death notification form or task the end-of-life care team on System 1 to let us know this patient has now died and can be taken off the end-of-life care register. It's a really simple document, and even if you've never had any training in it before, it's self-explanatory. Just work through and answer the questions and get the GP to sign it within 24 hours. But if you do feel that you need any further training, I'm happy to provide training on it if you get in touch. We are planning to re-audit the PACA in May 2019, and by simply just using the palliative care handover form, it will automatically improve most of the results, as by using the handover form that documents things such as DNAR, PPC, and the colours green, amber and red. Palliative and end-of-life care education has changed recently. There is now communication skills training, which is half a day. I'm aware that this is mostly fully booked, but more dates will be added towards the end of the summer. Symptom control study day, which is suitable for nurses. The palliative and end-of-life care study day, which is suitable for nurses and auxiliary staff, but as an update, and that should be after they've done the introduction to end-of-life care, which is for any new starters, nurses or auxiliary staff new to the trust. After doing the introduction, you can then go on the palliative and end-of-life care study day as your update. All the dates are on the staff zone. My contact details are on the bottom corner there, so please do feel free to get in touch if you feel that you need any more training, or if there's anything else you would like to discuss. I'm more than happy to take any questions via email or give me a call. Thank you.